It is under scrutiny, and I'm talking to Dr. Baluku. Dr. Baluku is a very, very, very self-motivated doctor. He does write within the New Vision. That's when I first got contact into him. And I'm still wondering, why is he in medicine when he has a lovely voice? He actually does sing as well. I think we'll talk about that at some point, maybe in another show. I mean, you will not believe this. He has a wonderful, wonderful voice and a huge sense of humor. Why didn't you do comedy and music and you ended up being wasted in medicine?
But you just say that I do music. So actually, to that question, I've already answered it. I do music.
Yeah, you're a man of all talents, are you?
Now, you know, so medicine is an opportunity to show compassion. Yes, and that's very important. Whereas music is a passion, something that comes out naturally, something you don't have to study necessarily to do it.
So music is your first love. Medicine is your job.
You're putting me in a difficult place. But I would say medicine...
No, your seniors won't be watching this.
Medicine is an opportunity to show compassion. And I feel it's a childhood dream. And that motivates me to keep at it despite the environment that I'm working in. For music, it's something that flows out naturally. And I don't have to think about it. I don't have to debate about it. I don't have to stress about creating time because I can't avoid it.
Interesting. Can a doctor develop feelings for their patient?
I would say yes. Yes. I mean, speaking about human behavior, anybody can develop feelings for anybody in their close proximity as human behavior. But it is unethical for you to establish a relationship, a sexual relationship, a romantic relationship with the patient under your care. It's unethical and it's best avoided.
Of course, we understand that. But I mean, aren't there patients who, because you see when you treat people and then they develop a relationship with you and all of a sudden phone calls are ringing and this patient is all over Dr. Baluku. Have those things happened?
To doctors? Yes, they have happened. But I'm saying that part of the training is to restrain yourself, to observe the ethics and the integrity of your profession. Otherwise, if we would get emotionally involved with everybody, then...
No, not everybody. The one, because are your trainers expecting that you won't get married or that you will only get married to people from where, Mars or something?
Of course they do expect that we get married. But you know, there are guidelines to help us keep the integrity of the profession. I mean, you imagine today I break up with my patient, then next time there will be another patient, and again we break up with that one. I think it...
Not with the particular patient, but this, because there might be this one who came, of course, they had their malaria, you've treated it, but the Lord has willed that they have 90% of what you've been looking for in a wife. Do you just turn your eye away from that and go with the ethics? I mean, to be honest.
I would say for the sake of your integrity as a doctor, you are safer avoiding any social...
Doctor, I'm not buying that.
Why wouldn't you?
I mean, if she's what you've been looking for.
What you've been looking for. You know, you do a benefit risk analysis. The risk to your profession, the risk to your integrity, and then the risk to losing the love of your life.
Okay. I know where that would go. Should doctors marry other doctors who understand the rigors and the challenges of the profession, in your opinion?
I would say that people of the same profession probably understand the work environment and they have more in common to talk about, and that would increase their social bonding. When you talk about even every other profession, people of the same professions would increase their social bonding. However, marrying somebody who is different also creates variety in a relationship, you know, and also the way you bring up children, you inspire them to be different things. So I would think there's no yes or no answer to that question. Yes, and it will be subjective depending on your interest as a person.
Okay. What have been your biggest frustrations as a doctor?
As a doctor working in this
you talked about, as a doctor working in, of course you talked about losing a patient, but as a doctor working in Uganda, what are the deepest frustrations?
One of them is having nothing to do when you can do something. And I'll explain that. What I mean is, imagine a patient who walks into the hospital and they need an urgent blood transfusion and there's no blood in the blood bank. Imagine a patient needs a special type of drug and it's not available and the patient cannot afford it. And so you fold your hands and look on when you can do something, but you can't do it. That is the biggest frustration as a doctor working in this country.
And what has been your biggest achievement as a doctor working in Uganda? And you're like, I'm glad I did this.
My biggest achievement is the contentment I get by working for underprivileged people, especially in public hospitals. I'll be honest with you that public hospitals are for two categories of people: the very sick and the very poor. When I serve the very sick and the very poor, I find contentment in that. And I also feel that I'm giving back to the country that paid my tuition as a university student under government scholarship. And that is enough for me as a doctor. As long as I can give back to my country, that's enough for me.
How many of your, classmates have left the country to go and work elsewhere?
I may not have a count as such, but a good number. At least I can mention about 10. About 10.
Wait a minute.
Mention about 10.
The people who came in the same year you did, yes. 10 have gone.
Yes, about 10 that have.
And we've spent money on them. Isn't that sad?
Of course it is sad, but there are many factors that, as you are aware, that could cause to that. There are push factors and the pull factors. There is a better pay the other side, so that pulls them to go that side. There are better opportunities for career development. Some countries, for example, you're a doctor, they'll give you free education to a master's and super specialize. There are better working conditions that side. And when you come here also, there are push factors. The pay is bad, and even somehow, to some extent now, medical practice is being very politicized.
I mean, talk about that.
In the sense that, if, for example, a mother dies under your care, before they even investigate what the cause of the problem was, you will have handcuffs. You'll be already behind the bars. So that itself demotivates working in
Are they trying to deal with mother mortality?
Yes, probably. Probably they have good intentions, but the methodologies, yes, methodologies are demotivating to the health workers. If you arrest me, what are the chances that next time I'll see a mother who is coming and is about to die, I'll put my hand there to try to save?
Are you saying that if I sued a doctor, I am calling trouble against myself?
I would say to some extent.
Would you advise anybody to sue a doctor?
To sue a doctor? You're asking a difficult question, because you're asking a barber whether you need a haircut. Dave Barber would definitely say yes. Now, if you ask a doctor, do you advise me to sue you? I would definitely say no. Obviously. Yes. But I think for reasons such as, number one, next time you need health care, and everybody will try to avoid you if you are fond of suing doctors.
But you have taken an oath that you can't do that. You can't avoid treating patients.
Ideally, I shouldn't.
I mean, I'm saying you in terms of second person plural, that the doctors take oaths that they cannot
avoid offering treatment to somebody.
Yes. So whether I've sued you or not, you have to treat me when I
should be able to. Yes, of course, the oath is there, the laws are there, but if human behavior is very complex. It's very complex. I may not probably walk away from you, but I can delegate, because even me as a doctor, I have a degree of a right of discretion to say I cannot offer care to this patient, but I can request my colleague to do so. For example, if you're my close relative, I cannot operate on my mother. Why? Even if I wanted to, I have some degree of discretion. If I have a personal problem with you, a land wrangle, it will not be wise for me to take you to the operation table. If you die, people might conclude that the cause of your death was because I had a personal issue with you.
Maybe that was, well, that's another matter. Maybe the ethics will not allow us to get into that. Where do you see yourself in 15 years? Director General, Medical Services?
No, my interests are more in private practice. I would think that in 15 years I should be able to have put up a place that can help especially people who are disadvantaged. I have special interest in renal medicine, medicine to do with the kidney, and also chest medicine, especially tuberculosis.
Definitely, you don't have a political career, do you?
No, not at this time.
Not at this time. Not at this time or never.
Yeah, but you see, politics transcends every aspect of life. When you say political career, are you saying whether I'm planning to join NRM or FDC? Or?
No. I'm saying standing for parliament and those sorts of things.
Well, probably if it comes, we'll see when it comes.
I hope not, Dr. Baluku.
Why is that so? It's good if you can influence policy and help a majority of people and influence policy. I wouldn't say it's a bad thing if a political...
Sadly, I think you might end up in politics. We are going to take a break here, but I can promise you that next Sunday we are having Dr. Baluku talking about, well, is it answering the question, is drinking probably bad for our health, or is it bad for our health? What are the medical facts about alcohol, and what is simply pure religion? Now that's the show for next week. Thank you so much for watching Under Scrutiny.